President of the Santa Clara County Medical Association, and I'm delighted to welcome you to session 2 of our environmental health series, Children and Technology, School Screens and COVID-19. Tonight we have Dr. Nicholas Kardaras, Dr. Victoria Dunkley, and 2 veteran school teachers discuss the perils and promises of digital technology and children. With the first generation iPhone introduced in 2007, we've seen technology skyrocket in our homes, our businesses, and now in our schools. We know the upsides of technology and how useful it is. And tonight we're going to look at some of the downsides and risks to learning, behavior, and development in children with our experts. Note that the next 2 environmental health seminars will be on Thursday, May 20th at 5:30 p.m. with Dr. Phil Landrigan. He's director of the Global Public Health and Common Good Program at Boston College and former director of the Children's Environmental Health Center at Mount Sinai School of Medicine. And he will be speaking on children's environmental health. Dr. Landrigan is an international expert in his field, and this will be an outstanding discussion on protecting our children's health. On Thursday, June 3rd at 6 p.m. is session 4 with Dr. Ted Shetler, who will be speaking on food and the environment, how our modern food system affects our health, planetary health, and opportunities for change. Dr. Shetler is Science Director for the Collaborative on Health and Environment and the Science and Environmental Health Network. He authored The Ecology of Breast Cancer and co-authored Generations at Risk and In Harm's Way, Toxic Threats to Child Development. He has a wealth of knowledge and experience in health policy for children as well. Considering that healthy food sustains us and connects us to each other and this earth, this is going to be a very energizing session to end the 2021 series. So check the SCCMA.org website for details. Each will be available for 1.5 units CME for physicians. However, if you're a non-physician and you wish to attend, you just email Samira Manucher and send in your full name and the sessions you would like to attend, and Samira will register you. So just a bit of housekeeping. This program will be recorded and will be posted on the SCCMA.org website, first on the front page initially for viewing, and then under resources. During the webinar, your microphone will be muted. We will take questions at the end of the presentations. If you have any questions, then go ahead and put them in the Q&A box. And if you wish to speak during the Q&A, just raise your hand and you will be unmuted. This program is also available for 1.5 units continuing medical education that you will receive after you complete the survey. Samira will put the link in the chat box at the end of the session. So now I'm pleased to introduce my co-moderator, Dr. Siham El-Dawani. She's a pediatrician and director of the Teen Health Center at Kaiser Permanente San Jose Medical Center in Northern California. She's a very busy physician, but she also volunteers her time with many organizations, including Doctors Without Borders, Alliance for Smiles, and Research. Dr. El-Dawani is also past president of the Santa Clara County Medical Association. Thank you, Dr. El-Dawani.
Thank you, Dr. Russell, and thank you all for choosing to spend part of your evening with SCCMA. Now, it's my pleasure to introduce our first speaker.
And we have a little trouble hearing you, Siham.
Oh, okay. How about now?
That's perfect.
Okay. It is my pleasure to, and thank you, Dr. Russell, and we'd like to thank you all for choosing to spend your evening with us here with SCCMA. One second, right here. I apologize. So it is my pleasure to introduce Dr. Kardaras. Dr. Nicholas Kardaras is a psychologist and is an internationally renowned. Is it okay to stop for a second? Are we going? Yes. Are we live?
Yes, we are.
Oh, okay. Sorry. I apologize. I lost my.
I can read it if you want.
No, I will. I'll do it right here. Say my apology. I have 2 computers running at the same time.
Oh,
so,
yeah. We're high tech.
Samira, how to make it? Okay, the screen smaller, the writing smaller.
You know what, Siham, I'm going to go ahead and I'm just going to go ahead and introduce right now, and then we can pick up on the next one. How's that?
Sure. Yes.
Okay.
Go ahead.
Dr. Nicholas Kardaras is a psychologist and internationally renowned speaker and one of the country's foremost experts on mental health, addiction, and the impacts of our digital age. He's the CEO and Chief Clinical Officer of Maui Recovery in Hawaii and Omega Recovery in Austin, Texas. Dr. Kardaras is a former clinical professor at Stony Brook Medicine in New York, where he specialized in teaching the neurophysiology and treatment of addiction. He's the author of the best-selling book, Glow Kids, How Screen Addiction is Hijacking Our Kids and How to Break the Trance, a seminal book on the clinical, neurologic, and sociological impacts of tech addiction, which has now been translated into 10 languages. He has also written for Time Magazine, Scientific American, Psychology Today, and Salon, and has appeared on ABC's 2020, Good Morning America, CNN, the CBS Evening News, Fox and Friends, NPR, and Esquire and Vanity Fair. He's been featured on the A&E's TV series Digital Addiction. So thank you, Dr. Kardaras.
Hey, thank you, Cindy. It's my pleasure to be here. And really, I'm thrilled to be speaking to an audience of medical practitioners, because I do think this is really a critical issue of our times that to a large degree has fallen underneath the radar of medical attention and clinical attention. Here we are, we're all living through the pandemic and all the viral aspects thereof. And what we've begun to see, mental health providers like myself have seen what we've come to also call the shadow pandemic, the mental health crisis that's happened as a byproduct of COVID-19. Essentially COVID-19, in addition to the devastation it's caused the world over, has only amplified and exacerbated an already brewing mental health epidemic that we were experiencing pre-COVID. Pre-COVID, we had the worst mental health metrics in recorded history. We had the worst anxiety, depression, suicide, and overdose rates. In 2019, there were over 47,000 suicides. In 2019, again, pre-COVID, there were over 72,000 fatal overdoses. We had record levels of depression. We had record levels of ADHD. By every conceivable metric, we were not a very mentally well society pre-COVID. And then we saw COVID, and we've seen those metrics have now skyrocketed. Depression rates by some statistics have tripled. Anxiety rates have gone up. Benzodiazepine prescriptions, all the psychopharmacological solutions have all gone up through this last 14-month period. The thing that we, I think, as a society had underappreciated is the impact that the digital age has had on our mental health. And part of my narrative and part of what I've written about is many of us who are adults who've grown up in the society, we're smitten. We all love our devices. We know that technology can be a wonderful and amazing thing. And I think perhaps we underappreciated what some of those mental health impacts were on our society and on our youngest, who are the most fragile, most developmentally fragile. So I started seeing both in clinical practice over 10 years ago, this this increasing rise in ADHD, in anxiety, and depressive disorders. And they seem to correlate with what the intersection of screen time. And so I was part of the initial movement that was trying to raise awareness of this thing called tech addiction, which was pushed back against by some folks at the DSM. And I was part of a committee that was really trying to get this to be an official clinical disorder. And now that's almost the World Health Organization, the ICD-11 has accepted gaming disorders an official diagnosis in its latest ICD-11s. Now that we've accepted that there is a thing called tech addiction, we have to better understand, what is tech addiction leading to? What are the other mental health outcomes that are springing out from somebody being on their screen too long? And the simple way to understand it is that we know the research is clearly showing the bidirectional impacts of screen time and some mental health impacts. And the narrative is, the simple story is, we're not evolutionarily designed to be as sedentary, screen staring, isolated, not community connected, meaning devoid beings. And essentially screen time has dropped an atomic bomb on our physical activity and on our social connection. We've been given counterfeit social connection through social media platforms, and we've lost face-to-face connections. And the research is clear that this is not good for our mental health, that we need face-to-face connections. So I do want to share a few slides just to maybe help illustrate the point. I was talking before about our mental health crisis. If you're a human being on the planet in the last 10 or 15 years, you've seen the let me go to my, I'm trying to get into presentation mode. You've seen the tribe that you see in front of you. It's not allowing me to go to presentation mode. Give me a moment. The zombie apocalypse, anyway, when the screen adjusts, it'll go back to. And one of the more frightening statistics that we've seen, there we go, thank you. And I want us to focus a little bit on a couple of these statistics here that were from a couple of years ago. So adolescent suicides have doubled over the last 10-year period. So from 2007 to 2014, we've seen a doubling of suicides. The main driver of that, if we look at the numbers, so the last box in this slide says the teen use of electronic devices for at least 5 hours daily more than doubled from 8% in 2009 to 19% in 2015. These teens were 70% more likely to have suicidal thoughts or actions than those who reported 1 hour of daily use. So, and that's not an insignificant number. That's a very statistically significant number, 70, that young people who are on screens for more than 5 hours a day are 70% more likely to hurt themselves. And that begs the question, what about being on a screen makes kids want to kill themselves? Is it the content? Is it the medium itself? Is it the fact that they're sedentary and not being outdoors with other kids? Is it all of the above? But essentially what we're having is an entire generation crying out for help. And we as the adults in the room and as the mental health and medical professionals, we need to be more aware of what some of these impacts are to be able to do a service to our young people. So the general categories that we can say that are impacted or exacerbated by screen time are addiction, increased rates of ADHD, there's increased levels of aggression, there's mood disorders, anxiety and depression, and we've also seen some thought disorders. And that's how I came into this. I came into this arena about 11 years ago when I had an adolescent that was referred to me that was in full-blown derealization. He was having what seemed to be a psychotic break. And when questioned further, he had been playing a video game called World of Warcraft for 10 hours a night for multiple weeks, sleep deprived, and was in full-blown, he was in the game. He had fallen into the matrix and couldn't discern where his game ended and where the real world began. And that was my first aha moment that there's something more significant happening here, because I was very used to working with substance-induced derealization and substance-induced psychosis, the proverbial bad acid trip or a crystal meth psychosis, but I'd never seen psychosis that was the result of a screen experience and sleep deprivation. And he was one of what eventually would become many. And now we're getting more research. There's brain imaging research. This was one 2019 JAMA study, JAMA Pediatrics, that looked at screen time and 2 to 5 year olds. And it looked at what was happening developmentally in the brain of a child of that really fragile age. And so it was children of 3 to 5 years old found that those who use screens more than the recommended 1 hour of day without parental involvement had lower levels of development in the brain's white matter, the myelination, the myelin sheath, an area key to the development of language, literacy, and cognitive skills. And this is one of the first studies that began to show the neurophysiological impacts of screen time. We've talked about tech addiction and what that looks like, and the main driver of tech addiction is the dopaminergic effect and how technology is a very hyper-arousing and hyper-stimulating experience on the brain. And so we know that the more dopamine activating that something is, the more addicting potential that experience or that substance may have. And we know this from some earlier research from Dr. Cope. Dr. Cope was a researcher who had done a study that was published in Nature, the journal Nature, back in 1998. And Dr. Cope looked at how dopamine activating a variety of experiences and substances were. And we saw that food could be potentially dopamine activating to a level of 50%. Sex was 100% dopamine activating. Cocaine was 350% dopamine activating. And crystal meth came in as the granddaddy of dopamine activation at my glasses here, 1,200%. But the interesting part of this study was he looked at video games as well, 1998 video games, which, while maybe not Pong or Pac-Man, were certainly not today's immersive and hyper-arousing video games. And they were as dopamine activating as a sexual experience, 100% dopamine activating. So when we look at how much they spike our dopamine, potential arousing screen experience, and how much they raise our adrenaline levels, we begin to understand that these are very immersive, stimulating experiences. And that's the other part of the equation that I feel contributed to our lack of awareness of this problem, both from parents and clinicians alike. Most of us were raised on television, and we, I think, equivocated or conflated modern screen time with yesteryear's screen time. The old rabbit-eared television set. You know, I remember as a kid growing up in New York having the old TV in the living room, and the one that you used to have to turn the pliers to change the channels with if the knob had broken. And the reality of it is that modern screen time isn't the same as television screen time. And fundamentally, for two key reasons. Modern screen time is immersive and interactive in a way that old television never was. Television viewing was a passive viewing experience. So I was several feet away from the television as a passive viewer. Our children today and young people today and adults today are immersed in the experience. We're participants in an experience. And so the impacts are much more psychologically impactful, very different than, and much more potentially harmful than television screen time. So how much like a digital drug is screen time? Because I wrote an op-ed in the New York Post a couple of years ago where I called it digital heroin, and I got some pushback on that. But the reality of it is the brain imaging research is showing that screen time does affect parts of the brain in a very similar way that substance addiction does. And there was an interesting research that came out of the military. The military were looking at developing analgesic pain management techniques that were non-pharmacological, because a lot of vets were coming back from combat and there were burn victims, IED burn victims. And those of you that have worked with burn patients know that part of the most painful part of treating a burn victim is the daily wound care, the debridement that has to happen where you scrape off the dead skin, which is excruciatingly painful. And typically burn victims are given high levels of morphine, become opioid addicted. And so what's a better solution? So two University of Washington psychologists were experimenting with an immersive virtual reality game that acted as an analgesic. And to people's surprise, and what was really shocking, was that MRI research showed that brain centers related to pain were more activated by the game than by actual morphine. And this is a picture of a veteran that's at a veterans hospital, and that's the nurse that's applying his daily wound care, and that's him playing the game. For my book, Glow Kids, I had interviewed one of the pilot participants of this study, Lieutenant Sam Brown, who was an amazing young man who had been burned over 70% of his body. And he told me that when I was given morphine during my daily wound care, it was still excruciating. It hurt like hell, quote unquote. But when I was playing Snow World, which was the immersive game that he was given as an alternative to morphine, he said, "Dr. K, I felt nothing." Now, we can say that this is a fantastic use of technology as a digital analgesic. But the question that begs asking is, how, if this is so powerful that burn victims aren't feeling pain, what is this doing to the developing brain of an 8-year-old or a 10-year-old or a 15-year-old? So how drug-like are some of these digital experiences? Well, a study that I particularly like to illuminate this is this 2011 Indiana University School of Medicine study. And why I particularly like this brain imaging study is it did pre and post MRIs on non-gamers. So it took 22 male participants and that were not gamers, and it had them, they had all the participants play, or actually they had a control group that didn't play, and then they had the experimental group that played, by most accounts, not an excessive amount of video games. 10 hours a week by most gamer standards is a fairly moderate use. And what they found was after 2 weeks of video play, fairly significant effects on the frontal cortex, the frontal regions which are most associated with our executive functioning and that control our impulsivity and aggressive behavior. I'm not going to go into the details of reading word for word the slide, but that's what we were finding. We were finding that screen experiences were essentially affecting the impulsivity. We were priming children by impacting the parts of their brains that were in controlling their impulsivity, their executive functioning. And at the same time, while we were doing that, we were hyperstimulating them by spiking their dopamine and dysregulating their adrenal systems by putting them into essentially fight or flight mode. We were activating their HPA axis in a way that wasn't very healthy. And then the other piece that I'd mentioned earlier is the depression effect. There's been a multitude of research that had showed the correlation with screen time and depression. There's been several studies that looked at what was called the Facebook depression effect. And what they found was that the more Facebook friends a person had, the higher the correlation with incidence of clinical depression. And that was attributed to something called the comparison effect. Essentially, the more Facebook friends I have, the more people's profiles I have to reflect back on myself and compare myself to. And if I'm not having a particularly good day or year or month, I'm going to compare myself to the externalized, idealized digital profiles of other people, and in comparison might feel less than in my own life. That's one significant aspect of what's causing depression. The other piece was the lifestyle that screen time creates. Again, as I said at the beginning of my talk, being sedentary is not the way that we were wired to live. And a neuroscientist at the University of Kansas, Dr. Stephen Ilardi, who has studied depression globally, and his quote, which I think is quite accurate, "We were never designed for the sedentary, indoor, sleep-deprived, socially isolated, fast food-laden, frenetic pace of modern life." Dr. Ilardi did studied depression globally. And what he found, interestingly, was that the most mentally well people with the lowest depression rates, and in fact, some of these groups of people had zero low rates of depression, were indigenous. So indigenous, and specifically the Kululu in Papua New Guinea, which were studied for a 10-year period, over 2,000 tribesmen, and there was not one instance of clinical depression. And these folks had extremely challenging lives, and yet there was no depression. And Dr. Ilardi identified certain lifestyle attributes that immunized folks from depression. And part of that was omega-3 diets and social support. But those were the two main drivers. They were physically active and they were socially cohesive. And that essentially is what screen time has vacuumed out of our society. We've become a much more sedentary, and our children have become much more sedentary, and thus much more depressed, and thus much more mentally unwell as a result of this new, brave, new digital world that we've immersed ourselves in. So that concludes my part of the talk, and I'll pass the baton now to whoever I'm passing. Cindy, I believe.
Thank you so much, Dr. Kardaras. I'm going to take over. I apologize. I finally got better here at the Zoom.
Sure.
We feel that we really are practicing in the cradle of social media, and we bear responsibility in its judicious use. Thank you so much for helping us navigate this topic.
Sure.
And now it's my honor to introduce Dr. Dunkley. Dr. Victoria Dunkley is a board-certified integrative child psychiatrist in Los Angeles, California, with special focus on the physiological impact of screen time on the developing nervous system, mood, focus, sleep, and behavior. Dr. Dunkley has found in her extensive experience that interactive screen time can overstimulate and stress the developing nervous system, particularly in children with vulnerabilities. Dr. Dunkley completed her psychiatric residency and child and adolescent fellowship at UC Irvine's Neuropsychiatric Center. She has worked since then in a variety of community mental health settings and regional centers serving clients with neurodevelopmental disabilities, in addition to her private practice. She consults frequently with schools, interdisciplinary treatment teams, and the courts, and she specializes in working with children and families who have failed previous treatments. Dr. Dunkley is the author of Reset Your Child's Brain, a 4-week plan to end meltdowns, raise grades, and boost social skills by reversing the effects of electronic screen. She is currently involved in research looking at the impact of screen time on the development and severity of autism. She contributes regularly to Psychology Today and is a mental health expert for the Today Show, NBC News, and ABC News. Before Dr. Dunkley starts, we will view together a short ABC News video showing parents with 2 young kids obsessed with electronic devices and Dr. Dunkley's family intervention. Let's start by showing the video first.
Okay, oops. Okay, so let me just give a little bit of background and then I'm going to return to the Texas family of the video clip. So I am a child psychiatrist. I first became interested in the impact of gaming, video gaming and screen time on kids' mental health when I first completed my training in the early 2000s. I was working with a lot of kids in foster care and group homes, residential settings, and all these kids had a history of abuse and or neglect, and they all had histories of trauma. And with those kids, their baseline state is a state of hyperarousal. So I realized with those kids that even a little bit of gaming, they tended to be very reactive and aggressive, impulsive, dysregulated. And conversely, when we remove video games altogether, not just cut down, but removed altogether, that they tended to get better. So that was kind of how it started. And from there, I started using the same intervention with kids in my private practice. So they just had things like anxiety or ADHD, OCD, a lot of autism, tics. That was another thing. I saw a lot of kids with tics. And I realized that removing video games worked across the board, no matter what their diagnosis was. So I started to formulate this concept that really that the screen time is acting like a stressor or and basically like a stimulant. Okay, so back to this family. So Taylor was the little girl. I think she was 5, almost 6 at the time. And she had actually been, had to repeat preschool at the point that you saw. And she was at risk of actually getting kicked out of preschool again. She was having a really hard time functioning. I tried to play with her. She wasn't able to play. She was could hardly sit down. So what we do is we have the parents do a questionnaire, and then we kind of figure out 2 or 3 problematic areas that we then track. So you can see that she's got a lot of issues in this little grid on the left. But basically we tracked meltdowns, her focus, and then her oppositional behavior. So basically her meltdowns, the parents were saying that she basically spent, almost half the day in tears. 3 or 4 times a day, she was having a huge meltdown. And after 4 weeks, her meltdowns were more like 10 or 20% of the day. So more than a 50% reduction in meltdowns. Her attention span, the mother said when I asked how long her attention span was before the fast, she said 5 seconds or less than a minute. And I can vouch for that because she really couldn't play for anything for more than a couple seconds. There was some concern that she might have ADHD. I really thought that even after we did the fast that she really did have ADHD, but she didn't. So this might seem like a really extreme case, but this is actually quite typical, this response. So we see, so after the fast, her attention increased from less than a minute to 20 minutes on a consistent basis and up to an hour at a time, which is huge. That's a huge increase. The mother also reported that she was more obedient, that she was saying, yes, ma'am, no, ma'am, that she would answer when the mom called her. Things were much, much better. So that was Taylor. And then you saw her in her jiu-jitsu class. And in jiu-jitsu, they have to actually stand still and make eye contact with the instructor for several minutes, at the beginning of the class. So that was huge. She would have never been able to do that before. Jackson was the little boy. He actually was functioning much better. He was I think a straight A student, but he was taking a long time to get his homework done, up to an hour at night. So after the fast, he went from taking an hour to just 10 minutes. And then the other thing we decided to track was stomach aches. And I remember the producer saying, why would you track stomach aches? But it's because stomach aches in kids are almost always due to stress. So he was complaining of stomach aches daily. Sometimes he'd get them twice a day. And that went from daily to about 1 a week. So that was about a 90% reduction. So that also is huge. We also tracked keeping his room clean. And by the end of the fast, he was keeping it clean and organized on a daily basis. Okay, so what's going on? How do you explain all this? So basically, there are numerous mechanisms that contribute to the stress response or the fight or flight response that are related to screen time. So first we have the addiction pathways. Dr. Kadaris was referred to this earlier. This is the dopamine pathways. These pathways actually become worn out and desensitized so that the same amount of dopamine doesn't work as well anymore. So that's why the kids keep looking for more and more stimulation. And dopamine is important not just for focus, but also for movement, organization, and for mood. Okay, there's also a lot of intense sensory stimulation. So that also contributes to that hyperarousal state. So there's vivid colors, the rapid pace, there's auditory input. So it's a very heavy load on the brain. And then there's the light coming from the screen. So we know that screen light has a lot of blue and white tones. When this actually mimics the sky and it tells the brain to be on the alert, that it's daytime, wake up. But what this does is it actually desynchronizes the body clock, which is regulated by light. And that also suppresses melatonin, which is a sleep hormone. But melatonin also, in addition to being a sleep signal, it also is a potent anti-inflammatory in the nervous system, in the brain specifically. And it also is a hormone regulator. So once melatonin is suppressed, a lot of other things can become dysregulated also. Then we have multitasking. So medium multitasking we know is actually very stressful in the brain, and we tend to get worse at it the more we do it. So that also increases hyperarousal. The interactive nature. So interactive screen time is more stimulating and it's also more addicting. And then we also have electromagnetic field. So the interesting thing about the radiation piece is that there's studies showing that it also may suppress melatonin as well as activate that sympathetic nervous system, which is the fight or flight system. So all of these things are occurring simultaneously. And you can see that most of these don't have anything to do with content or what the child is actually doing. It's just the nature of the screen itself. So it's really the medium, not the message, or at least not just the message. Okay, so I coined this term electronic screen syndrome because I was seeing so many kids being misdiagnosed and being put on medication inappropriately. So I wanted to kind of name what I was seeing, but also because there's a kind of a constellation of symptoms that can occur that are related to hyperarousal, but it doesn't look the same in every kid. But what we're seeing, what happens is that you get this overstimulation of the nervous system, high stress hormones. And then what happens in a stressed brain is that the blood flow actually is shunted from the frontal lobe, or the higher thinking parts of the brain, down to the deeper, more primitive parts of the brain. In addition to that, we have the desynchronized clock. Then we also have the altered brain chemistry, the dopamine we already talked about, but also there's some evidence that serotonin is dysregulated as well. And so what happens is all of these reactions essentially like short circuit the frontal lobe. So if we look at what the frontal lobe does, it controls everything that makes us human. So it's emotional regulation, executive functioning, things like planning and prioritizing, getting things done, as well as things like impulse control and creativity and empathy. So all the things that make us human. So if the frontal lobe starts to malfunction, any and all of these areas can become impaired, and the child can have the way that manifests can be any or all of these issues. Okay, so what does this look like? As I said, being overstimulated or electronic screen syndrome or overstimulation, whatever you want to call it, looks different in different kids, but a very typical way is that they'll be really irritable and they can't focus. So they're not functioning well in school. And mood wise, they tend to be very irritable, lots of crying. They might be very angry or anxious. Some older kids might have full-blown rages. Younger kids might just be having a lot of tantrums. The parents often say, we find ourselves walking around on eggshells. Cognitively, they tend to have very poor focus, poor short-term memory. They have trouble retaining information, disorganized. They're forgetting things, can't plan very well. And then we also see, as Dr. Kardaras had mentioned, we do see some psychosis in these kids and young, teens and young adults as well. So it can be that they actually do lose touch with reality, but in other cases I've seen they just become paranoid, like they think people are outside their window or people are talking about them. In other cases I've seen some visual hallucinations, and but they still have some reality testing. So obviously the best way to test this is to remove the gaming and see if they're still psychotic, because God forbid you don't want to put a child on an antipsychotic who doesn't need it. Okay, so behaviorally, these kids are in a very defensive state. So they tend to be very oppositional, defiant. They have low empathy because when you're in that survival mode, you're not thinking about the other person. You're not able to put yourself in someone else's shoes. Okay, and here we have a parent who is watching TV and the kid's, he's saying, why aren't you reading a book? So we know that parents, it is important for parents to model good screen habits, but what's also happening is that when the parents on their devices, or even when they're distracted by their devices, even if they're not on it, there's less eye contact. So eye contact is one of the strongest predictors of brain development. So, even if on a daily basis, it's a few minutes less, all of those minutes add up. So we're also having, when parents are on their devices, there's less conversation. And these are all predictors of speech development, attachment, social well-being, lots of things. And, all of these things add up. So these are all the, basically, overstimulation from screen time can mimic or exacerbate virtually any psychiatric disorder. And even neurologically, as I mentioned, I was working with a lot of kids with autism. That still is a big part of my practice. And a lot of the disruptive behaviors get better once you get rid of screen time. And their whole brain is really, really vulnerable to the effects of screen time. So they already have low melatonin. They're already in a state of hyperarousal, and they have trouble regulating arousal. Their dopamine system, their serotonin system, that's all already dysfunctional. So it's really a setup for kids with ASD. Also, tics I mentioned earlier, tics are actually dopamine driven. So it makes sense that screen time makes it worse. So sometimes you can see the kids start ticking when they're on the screen or right after. In other cases, it's not as obvious, but when you remove it, within a few weeks, the tics get better. And tics is another thing, by the way, that's also on the rise right now. So these are some of the brain imaging findings. So there's quite a number of findings that the imaging research has shown. One of the biggest ones is that there's gray matter atrophy in the frontal lobe areas and in other parts of the brain. The cortex tends to be thinner. White matter is more, the white matter, which is how the different parts of the brain connect to each other, as well as the brain to the body, tends to be more fragmented and spotty. So that's like the communication's not working. And as Dr. Kardaras mentioned, these changes look similar to alcohol and substance abuse. And this was surprising to the researchers because they didn't expect it, because the person's not really ingesting something. But what we do know is that the eyes are actually an extension of the central nervous system. So it makes sense that information that's coming through the eyes to the brain can actually impact the brain. So what do we do about all this? So as I mentioned, one of the first things I do with everybody that I see these days, and as well as my current patients anytime they start to go downhill, as I always do, I try to do a strict extended electronic fast or a screen fast for at least 4 weeks. And what this does is it helps reset the nervous system back to its natural baseline. And then from there, you can decide whether you want to keep going, which is, recommend. It allows the parents to see what their child it looks like. And a lot of times parents say, oh, I've got my child back. But if you just, propose it as a 4-week experiment, then it's a lot more palatable to parents. And then after the 4 weeks is over, then you can decide if you want to keep going to get more benefits. The Texas family actually in that video, after about 6 weeks, I had contacted the mom. She said, yes, they were still screen free. She said they had actually started to reintroduce and then said, forget it. And then I contacted her again about 6 months later, and she said they were still screen free, and they were so screen free, they never even watched the clip. So they really did a 180. Okay, so this is all the physiology. So all of these things should renormalize. The body clock should resynchronize. All these stress effects should normalize, and the blood flow should return to the front part of the brain. These are just a couple case studies. Of these parents, these are spontaneous testimonials of parents who did the program and then wrote to me. So this child, his reading level went up a whole year's worth. And then this child was pretty dysfunctional. I think he was on the autism spectrum as well. So he had some attachment issues. So he was in special ed. He was not able to leave the house without kicking and screaming, the mom said. And he went from that to going to the library, playing with his siblings, playing by himself. He wasn't reading before that, but now after the fast, he was able to sit on his mother's lap and read a book. His handwriting changed. So all of these are really manifestations of a better integrated frontal lobe. He also got off his medication and stopped needing melatonin to sleep and was going to bed on his own. Okay, so whether parents do the actual fast or not, these are some good, I'm going to speed right through these. These are some rules that are helpful for everyone to follow. No screens in the bedroom, doing homework in a community area, monitoring it, 1 screen at a time, no multitasking, designate screen-free times and zones such as dinner. The bedroom should be screen-free. Outings with, as a family going out to dinner should be screen-free. And then become a digital minimalist. So get rid of all those extra, old phones, random laptops sitting around, all, especially like the iPad and tablet stuff. Just get rid of it if possible and just use a desktop. But the iPad's really, really problematic. And then of course, parents should have screens. They should have rules as well. And it's helpful to, for the kids to be able to call the parents out to make, so that everyone's doing it together as a family. And also for parents to have a conversation to say like, how does mom and dad's screen time affect you? How do you feel about it? That can be a really eye-opening conversation. Just a couple studies I want to mention. Gentile's group at Iowa State, they did a study looking at screen time. And if parents actually monitored screen time in terms of limits, as well as got rid of violent content, that those kids tended to have healthier weight, they slept better, they were less aggressive, and they tended to have higher grades. And numerous studies have shown that screens in the bedroom is correlated with obesity. So if you have a family that's really struggling with not just screen time, but obesity, that's the first thing to recommend, because that really is evidence-based. So we know that having just the presence of a TV correlates with obesity, and also using small screens. So, tablets and iPads, cell phones in the bedroom. These are some evidence-based protective factors. These actually help the brain integrate and actually can thicken the cortex. So these, many of these have to do with movement and attachment. And just briefly, I want to go over the American Academy of Pediatrics' newest guidelines, This is just a summary that 0 to 2 is no screen time with the exception of video chatting. 2 to 6, less than 1 hour a day of entertainment-based screen time. And older, the previous guidelines recommended less than 1 to 2 hours a day of entertainment-based screen time. And now the recommendation, they kind of got away from that and just said, make sure that the child's getting enough sleep, exercise, and doing other screen-free activities. So those of us who are working on the front lines in the screen time and tech overuse world, we were a little bit alarmed by the changes, and we just felt like it doesn't go far enough, and that we've kind of felt like the guidelines were trying to just be more consistent with social norms, but they're not necessarily best practice. So some of the issues are that they assume that educational screen time is risk-free, and that's not true. I'm sure Joe and Matt will get into that a little bit more, but if we go back to my other slide about all those stress-related factors, all of those exist with educational screen time, whether it's an educational app or doing your homework on the computer. And we also know light at night is particularly harmful, which is what all the kids have to do. If they have to do homework at night, they're on the computer at night. Another problem is that they're assuming that the recommendation is 1 hour, no screens 1 hour before bedtime. That's not necessarily enough for a lot of kids. A lot of kids, even if it's 3 hours before bedtime, it still can trigger them and put them into that fight or flight state. And also we know that total daily screen time, it also predicts sleep issues. Okay, so basically we want to pace technology exposure according to individual needs and also developmental needs. We want to realize that restricting screen time and technology exposure actually protects the frontal lobe, and the frontal lobe is where self-discipline is. So that protects the child and optimizes brain function, no matter what field they end up going into. We want to use these electronic fasts more readily. I do this a lot with kids who are really struggling in school. I work with the schools to just try it as an experiment. Sometimes they don't want to do it, sometimes they do, but we just keep working on it. And then it really can make a huge difference for school, virtually for every kid. Another option is to, offer wired, or I do talk to families about using wired only internet access. It's really hard to get families to do it, but it does really reduce not just EMFs, but accessibility. Okay. And lastly, I will leave you with this. This guy is saying it keeps me from looking at my phone every 2 seconds. And this slide is really to show that, we're, as human beings, we're really not very good at changing habits and having willpower to do so. And it's much more effective, the research shows, to actually change the environment. So, and that's it. I thank you very much for your attention.
And thank you, Dr. Dunkley. We all need to pay attention to what this generation is going through right now with technology. Thank you for educating us. And now it is my pleasure to introduce our final speakers, Matt Miles and Joe Clement. They are award-winning teachers and coaches in Northern Virginia for well over a decade. In 2017, they authored the book Screen Schooled. 2 veteran teachers expose how technology overuse is making our kids dumber. Since then, they have spoken out about the problems created in screen-dependent children and issues around educational technology. Matt has authored articles published in Psychology Today, Education Week, and the Washington Times. Joe has authored articles published in Richmond Times Dispatch, Psychology Today, and numerous other publications. They will discuss their experiences in classroom after digital technology was introduced in schools, as well as how COVID pandemic has affected students' learning and behavior with full immersion in the digital classroom. They will address the question, is this what is best for students? Matt and Joe, thank you for taking the time, and you are very welcomed, and I'll turn it on to you.
Thanks very much.
Thank you.
This is a great event. Really happy to be here and be part of this. Before we get going, anytime Matt and I speak, we always are contractually obligated to give a disclaimer that we are in no way speaking on behalf of our employer, which will be painfully obvious here very, very quickly. Look, Matt and I don't bring really a lot to the to the table, other than our experience that we've had in the classroom. And we've got between us, we have actually this year we have 40 years between us in the classroom. Most of those are my years, as Matt is fond of reminding me. But we have a whole bunch of classroom experience, and we saw things really starting to fall off well before COVID. And so we started to look into it. We ended up writing the book, the aforementioned book. And in the process of writing that book, we talked to teachers, principals, parents, all over the country, really all over the world. And so we have that. And the thing that I think people find interesting if you're not a teacher is you don't really know what goes on between 8 and 3, right? Your kid goes out the door, and I mean, you have some memory because you were in school, but today what's it like, and so on. So that's really our value added. We're going to give you a little peek behind the curtain, and we're going to start with what I think probably over the last 14 months is maybe the worst kept secret in the world, or one of them, and that is that this year the kids learned nothing.
Nothing.
And I mean, when we say nothing, I'm sure they learned some stuff, but it wasn't what we're
not in school.
There was no school learning. And that's really it. Yeah, the rest of the slide, there's no more to those bullets. It's just that. And I should say that we're not just virulently anti-technology. We are virulently anti-policies that harm children. That's what we're against. And this has made very clear, what we've seen over the last year, especially, has made very clear that's exactly what's going on. And you heard a lot of the psychological statistics earlier. We're making things worse for kids, and one of the problems is going to be what happens after, once things go back to whatever normal looks like. And you'll see it here. Matt's going to kind of walk you through what school looks like.
Yeah, so this is what school looked like for Joe, and probably it's funny. Anytime you read a piece about ed tech, this is the image they use of a schoolroom. They think that this is what school looked like till 2010. But anyway, so this isn't what school looked like for kids this year, obviously. So it looked more like this. So, one of the things we're very careful of is we don't blame kids for any of this. This isn't a shaming of kids. This is something that's being done to them, and mostly by adults. And this is what we're asking them to do. So try to put yourself, imagine what it was like to be them. So their classroom this year didn't have desks and chairs and chalkboards and peers, right? There was nobody sitting next to them. There's nobody interacting in any kind of way. Like, it's just them in their dark room for 8 hours a day, staring at this, right? A PowerPoint slide or a YouTube video on the screen, a lot like what you're looking at right now, right? A little icon in the corner of your hunky teacher sitting there or whatever, nobody in the chat room, right? This is how they spend 8 hours a day. And you have some teacher, God bless them, trying their hardest to go on about something incredibly important, like the structure of DNA, for example. And maybe they're trying to make it even more engaging and levering technology to improve outcomes, right? So they're showing a TED talk of James Watson talking about how he's discovered the double helix, right? Or they're having the kids interact with a manipulative DNA molecule. And okay, maybe some learning could happen in that environment, right? But that's not all that's going on in their classroom. Remember, they're most of it, especially talking about late adolescents, they're in their rooms by themselves, unsupervised, while parents are working, right? So just a click away, they have every single person they've ever met, a whole bunch of people they've never met, all vying for their attention via social media, right? They're vibrating, they're flashing lights and saying, hey, look at me, look at me, look at me, right? Right behind them, another click away, in the corner of the room, right, you have an arcade and you have any game, limitless plays ready to go. In this side of the room, you got a movie theater that has tons of movies, access to any type of cool show. And of course, you have a mountain of pornographic material you couldn't watch in 10 lifetimes, right? And add on top of that, you're trying to focus on the DNA, but you were up till 2 or 3 a.m. doing what the kids call today sad boy hours, and that you're just staying up late, right? And we're trying to ask you to do something that's cognitively difficult and challenging. It's no wonder that kids had such a hard time this year, right? What we're asking them to do is virtually impossible. You can't imagine a worse place to learn.
Virtually impossible. That was good. This Matt was talking about this year, and obviously there's a huge focus on that. This isn't new though, right? This goes back well beyond COVID. This Project RED is a group, it's a consortium of ed tech companies, educational technology companies. RED stands for redesigning education or reimagining
revolutionizing. It's more
revolutionizing education. So it's this goes back obviously well over a decade, and there are all these criteria, they say, and that you need in order to successfully implement technology, and then all these things that are going to happen. We're picking on Project RED, but it's the same message from pretty much every purveyor of educational technology. And one of the big problems is you're talking about groups that are led by people like Mark Zuckerberg and Bill Gates, who are in business, and they're driven by profits. And I was an economics major. I teach economics, and no problem with people making profits out of schools. We need chalk, right? We need chairs and desks. So people sell things to schools. Schools need things. That's not a big deal. The big deal is when you sell things to schools that are bad for kids. And so you've got this profit motive, and they don't particularly care all that much about the fact that these things are bad for kids. So if you look at some of these claims, they're laughable. Many of them, if not most of them, properly implemented technology saves money. That's just funny on its face. Implementing these factors, if you do this right, you're going to outperform all schools. I mean, we've definitely seen that's not the case. That improves learning, and that's again laughable, and we're going to get into how that's laughable in just a minute. But things like that statement and this one that it increases learning productivity. When you tell kids things like this, like Matt and I are gluttons for punishment, so we'll talk about this with our students. They don't, we don't really even talk about our book at this point. We just talk about the fact that, we'll mention things like this. That, hey, do you guys feel more productive when you use your educational technology? And they know it's ridiculous because, as an aside, there's a war on homework right now, right? And we don't take any position on whether homework is a good thing or a bad thing or valuable or not. But one of the problems people say they have with homework is, well, there's just so much of it. My kid has 5 hours of homework every night. No, he doesn't, or she doesn't. They've got 20 minutes of homework that takes 5 hours because they're doing it on a computer, and they're a kid. And can you imagine being 15 or 12 or whatever, and being asked to have an infinite entertainment device that, also has your textbook on? It's asking a lot of a kid, and we just continue. We do this over and over, and kids know it's patently absurd. And so we when we go to training, we have to be trained in how to use technology and so on, and what kids these days are thinking. We get videos like this one. Let's take a minute here, but we'll show
I know.
this to you.
The sight of me on a device in class makes some of you nervous, but I'm not posting selfies to Instagram right now. I'm actually in a Google Hangout typing questions to a researcher in Botswana about water conservation. It's part of a project I'm working on. My friend Emma just found a blog from the Chesapeake Bay Foundation with some awesome info as well. See, technology provides great opportunities for us. It's a part of our lives, and my teacher is making sure I know how to use it safely and responsibly.
Yeah. Okay. I mean, Matt and I have caught students doing many things on their devices, but chatting with water researchers in Botswana is not one of them. I mean,
my students point this out. They say, if you're a 17-year-old girl talking to a guy claiming to be a water conservationist in Botswana, they even say that stay away.
Right. There's so what's getting messed up here is our thinking about what could be done. I mean, could that be done? Could a kid go to a Google Hangout with a water researcher in Botswana? Yeah, they could. I have a 6-year-old daughter. She could use my circular saw to make something really neat. I'm not going to give her that tool because it's not appropriate for her. And so what we've seen in this past year, that video of that girl saying that stuff was pre-COVID, but the last 14 months have left really no doubt that the emperor wears no clothes here. Louis Brandeis said that sunlight is the best disinfectant. And in order to really understand something, you've got to bring it out into the light and be totally transparent. Well, for 14 months, the educational technology industry has gotten what it wanted, and by pretty much any measure, it's been a spectacular failure.
Yeah, and put this in perspective too, just so you guys know that we're not two fogies just being like these kids and their devices. Like, it's quantifiable how hard this year has been on students. And again, we really want to reiterate this. This is a trend that was coming, right? Joe and I used to do that slide 4 years ago to warn against kids doing homework. We said, don't let your kids go up in their room and do homework all night with their devices. And now fast forward, here we are saying about all day school, but this is something that they've been asking for. And if you look, this is our school system, which shall remain nameless. If you look, they have a record number of Fs this year. So since they've adopted virtual school, right, their number of Fs have tripled. They've gone from 2%, which is pretty low, and that's great, to about 6%, right? And this is further still misleading because this is while we have essentially mandated policies that forbid Fs, right? It's really hard to have an F right now, and they've pretty much outlawed, but there's a significant number of kids who have figured out a way around that. And it's remarkable. And of course, there are other factors involved with COVID and the pandemic that are maybe contributing to this. But Joe and I have been studying this for a long time. And these styles of schools, if you're talking about like Summit and Rocket Ship, and there's these schools that utilize essentially what we've been doing this last year, they've been doing it years before, and they're all similar. And you could have predicted this kind of failure, right? And a lot of these kids have A's, no, we're talking about 6% F's. 60% of kids have A's, right? But I can tell you firsthand, they don't know anything, right? Like this is just from the other day. Like we're in May, and we're getting to a point. Last year I would have asked this question of them. What is, in-depth question about the 14th Amendment or concepts like selective incorporation. It was mostly just to poke fun at how little they know, but like, they can't talk about any concept. They can get A's on tests, but then you talk to them about it, they can't, right? And if you look at the frustrating thing is those of us who are firsthand interacting with kids, the teachers and the parents and the doctors and physicians and the psychiatrists, we know it, we see it, it's obvious to us. It almost goes without saying. But the frustrating part from our perspective in the education field is it seems as though educational policymakers are the only ones who don't get it. And Jeb Bush and Cuomo and Mark Zuckerberg and Bill Gates, they are not educational. They don't know anything about, they may have never stepped foot in a public school until their adult life. And they are the ones who are convincing educational policymakers that this is the future. Note the dates on these op-eds, or this op-ed right here, written by Jeb Bush. He declared in May of last year, just months after we switched to online learning, that this is the future. Keep in mind, he's been promoting this style of education in Florida for years, right? So this style of education is something that we've been speaking out against, and this was their chance to implement it, and they declared it a success, right? Cuomo immediately goes to Bill Gates and says, he hires him on as a consultant to revolutionize their education post-pandemic. So they're looking to implement all of these strategies they're using right now as the quote unquote future of education. It's a post-apocalyptic future if this is what we're looking at. And the issues with their policy, this style of education, is it's fundamentally flawed. It doesn't understand kids, it doesn't understand learning, and it doesn't understand teaching. You could say educational technology doesn't really understand education or technology very well, and that's why they get the results that they have.
So one of the probably most significant misunderstandings is the way educational technology misunderstands children. And the point of this slide here is we're social studies teachers, so do the old medieval and Renaissance art thing, and you may have seen pictures like this before, that in medieval art you get the creepy man baby, and in Renaissance art you get the actual baby. And it wasn't a function of, well, the medieval painters just weren't very good at painting kids. Art reflects life, and so the way art depicted children reflected what they thought about children. So in the medieval times, it was children are just little adults, and they have all the same parts as adults. They're just smaller, so they're just little adults, and we just have to train them to be, big adults. And over time, we've discovered that, and certainly in the Renaissance, they didn't have a full understanding of childhood, but they understood it was different. That kids were fundamentally different from adults with different needs, and they were going through different stages and so on. And the point here is educational technology today acts like the medieval painter, just totally missing the point about what are kids capable of. You look at a tool and you say, well, this tool could be used really productively, so let's give it to kids because they'll use it really productively. Something like, for instance, Microsoft Teams. So here's a screenshot of Microsoft Teams, something that businesses were using before COVID, right? And with varying degrees of success, but it worked for various meetings. So the thinking was, well, let's go to school, and let's make school look more like Microsoft Teams. And it'll, because what's a class essentially? It's a meeting. So we'll just do that, and we'll bring it down to kids, because kids are little adults, and they'll just behave like adults do. Well, they didn't. So you see that this was a national news, is a Washington Post article, but when various school systems started going to, in the beginning of the pandemic, started going to online school, as it says there, classes were hijacked by racist, homophobic, obscene language. Students appeared on screen naked, or they flashed weapons.
This happened, by the way, 20 minutes after they unveiled this. 20 minutes after they let kids on this platform, this went down. Right.
And it gets worse. I mean, you can see, I won't read all these horrible things to you, but the point is, obviously, that kids don't have that little stopper. The brain people can probably tell you what that little stopper is, but what, that thing that makes adults not just say whatever comes to their mind, the kids don't have that, right? And so there's this very bad misunderstanding of kids themselves.
Yeah, and we're talking to a group of doctors here, and so there's right? But the idea that kids' brains are different than adults, but that's something that isn't translated to educational technology in many ways. You have to, both Dr. Dunkley and Carderas talked about the lack of executive function from underdeveloped frontal lobes. You know, you're talking about a kid who he doesn't have executive function. He can't delay gratification. He doesn't have logic to prevent him from doing something like, you know, whipping out his genitalia in front of all of his peers, right? Like that's the stopper that he doesn't have. Kids don't have that, right? They're still developing their brains. That's what makes delayed gratification so difficult. Keep in mind, they also have a strong psychological urge to distance themselves from their parents and adults to establish peer groups. They want to find romantic interest. They want to question authority, especially when we're talking late adolescence here. These are their urges. And you keep in mind that games today are designed to exploit, and social media are designed to exploit these and take advantage of these and keep kids on their devices for, and this one quote comes from this John Hobson article written in 2001, 20 years ago. He wrote, he's a behavioral psychologist turned game designer. He wrote the format for making games addictive. And when you think about it, that's why kids use tech like they do, right? Notice not on this pie chart, we have passive consumption, watching TV and YouTube videos and communication, texting and social media and you don't see Botswana conservationist that's not on here, right? And that's what makes this so hard, right? A kid can't delay they want to be with their peers. They want to stay up late and talk to their friends, but these are what inhibit learning. This is a survey I gave to my kids. It's not very non-scientific, small sample size, whatever, just to kind of give you an idea. So first thing, take note, final column, non-response. Anything you ask a kid to do at this point in the year, you get about a third of the kids won't respond. Tests, quizzes, assignments, ask a question. Hey, how's your day? 30% non-response. So of the kids who are remaining, how much of them are sleeping through school? How much of them do school from bed? How much of them are staying up later than they've ever before? How much of them fake computer issues anytime they get called on or they have something to turn in, right? How many of them are spending most of their day playing games or on social media? How much of them are cheating on assessments? A majority of them, right? And the issue is all of these things don't just inhibit learning, they're catastrophic to learning, right? And this is why learning is so difficult. So learning is hard, right? One of the things that ed tech tries to do is make learning easy. Learning is hard by definition, right? It's kind of like we always relate it to, like, remember that fad where you could lay on the couch and you'd put these electrodes on your abs and they'd flex your abs while you're watching TV, eating popcorn, and they showed like the guys with six-pack abs. Like, that's the idea behind educational technology. Hey, you can just play games and you'll learn math. I've watched my kid, my 5-year-old has to play games. He doesn't learn math, right? He's learning to love to play games is what he's doing. And that's because that's not human nature. If you give kids a chance to take charge of their own education, they're going to do whatever's easiest, not whatever they learn the best from. And we actually learn more from difficult, cognitively challenging concepts than we do from easy concepts, right? But this idea is knowledge is important. A lot of you'll hear people say, well, why memorize facts if you can just look them up on Google? You need facts in your brain to understand what you're seeing in the world around you. You need to pull that fact out. You need to be able to use it in other contexts. And knowing facts and memorizing facts and having internalized knowledge begets new knowledge. So when you encounter a new concept, you say, oh, that's just like this fact. Our kids' brains are these empty vessels, just waiting to be filled. They're still empty. And the other issue is the biggest tool we have as teachers is assessments. And they're not tools to torture our poor kids. There's tools for teaching. Giving a kid a test has been proven to be the most effective way at creating learning and internalized knowledge. And there's no good way to do this with unsupervised kids virtually. And that's been one of the biggest hamperings we've had with digital type education.
And finally, I mean, talking about teaching, the misunderstanding of the ed tech industry is maybe the big misunderstanding is misunderstanding the role of teachers. If any of you have ever been in any kind of education class, you've maybe heard these phrases before: the sage on the stage versus the guide on the side. You're not supposed to be the sage on the stage. You know, you're supposed to be the guide on the side, man, because that's cooler. And it also puts the kid in charge of their learning. And I mean, have you ever met a 12-year-old? Would you put a 12-year-old in charge of anything? Have you ever talked to a 12-year-old? Like, the only people who could say something like that are people who have just zero experience working with kids. You don't want to put a kid in charge of his or her own learning. I mean, that's different than helping a kid have ownership and feel like they're, you know, part of the process of really developing an understanding or a new skill set or whatever. Of course you want to do that, but the idea of moving the teacher off to the side so the kid will, you know, talk to the water researcher in Botswana is, again, patently absurd. And the sage on the stage model, you know, it's critical of teachers because, well, teachers are there with like a Pez dispenser of knowledge and they're just shooting out these pellets of knowledge, and kids have to wait until the teacher tells them that it's okay to learn or whatever. And you know, that's not great either, of course. But the point of educational technology is to put the technology in the center for the kid. And you know, one of the things that they tell us to do a lot is that we'll record your lectures so the kids can go back and watch them later. Well, if I'm trying to teach, you know, 2 + 2 is 4, and I say 2 + 2 is 4, and the kid doesn't understand that, and then well, all right, well, let me rewind and watch it again. Okay, 2 + 2 is 4. That's what they're watching the same thing over and over again. Like if I were in a classroom and, you know, a kid said, I said 2 + 2 is 4, and a kid said, well, I don't understand that. Can you help me? And I said, 2 + 2 is 4. I just said the same thing again. I hope I would be fired. That's a terrible thing to do. A teacher isn't going to do that, of course, isn't going to just repeat the same thing over and over and over again. The teacher is going to search for the source of misunderstanding and help a kid, you know, come at it from a different angle, and figure out what's getting in the way of either developing the skill or learning the content or whatever. And one of the things we know is positively correlated with learning is an interpersonal connection with a teacher, an adult who cares about them. And this screen is obviously not caring about you or me. And no matter how good the algorithm is, that's not the same thing as having an adult there who is there to help you become the best person you can be. And that's the point of the teacher. And you don't want that off to the side.
Yeah, and nowhere is this more true than in communities that have historically struggled in school. And this 2014 study done by Duke foreshadowed or predicted the outcomes that we see today. And unfortunately, these are the exact same communities that Zuckerberg and Gates and other communities have or other groups have targeted the most. So we see a lot of these groups called Rocket Ship or Summit in inner city schools, and they've been overwhelmingly unsuccessful. And we see that this is especially true. This is a very interesting study. So what they did is they took a whole bunch of students and they looked for students of need, and they introduced, so students who didn't have internet access at home, they divide them into two groups. One got kind of an analog older version, and another group got new computers and broadband. And they were trying to measure the level of success of bridging that divide would do. And what they found was, and it's fascinating, is that introducing computers and broadband into homes of lower socioeconomic groups actually widened the achievement gap. It made the kids with the technology actually started significantly and persistently scoring lower on math and reading test scores. When you brought more tech into their home, you actually worsened the achievement gap. Precisely what we're seeing today. And this goes back to this idea. And when we're trying to fix the problem, no, everybody's trying to fix the issue. They're saying, well, how can we bridge the divide? And what they're trying to do is get more screens into these homes. And what we're knowing is that's not what's effective. Harvard did a study, Hunter Gelbach awesome guy we talked to. He did this study, and his intervention was this. It was very simple. It was the simplest, cheapest intervention. He sat students down and he gave them a survey, and he gave the teacher the same survey, and it had nothing to do with school. It was like, what's your favorite color? What's your favorite television show? What's your favorite football team? Right? And at the end of the survey, he would sit each teacher down with each student and just share with them what they had in common. That's it. That's all they did. And what they found was that simple intervention created a 60% reduction in the achievement gap. Just to put that in perspective, there's never been another intervention tried by any type of educational group that has found such a extreme reduction of the achievement gap. The achievement gap is one of the most notoriously difficult things to get rid of. This did it. Giving kids technology didn't do it. Why? Is they don't need screens. No kid needs screens, but especially kids in homes of needs and challenges. They need valuable teachers who are caring, guiding. We all need humans. I mean, it just seems so obvious, but.
And to wrap this up, there was a study done by Melissa Hunt at the University of Pennsylvania, where she, you see the title of the article there, Limiting Social Media Decreases Loneliness and Depression. She divided her students. You guys keep using the same amount of social media, you use less. She gave them a test of psychological well-being. Probably not surprisingly, the ones who reduced their social media use did better. Okay, we read it, we were pretty interested. So we because we were thinking of a different question. So we asked her, well, what about, what if you went the other way? You had your control group continue using social media like you usually do, but the experimental group, have them increase their amount of social media use. And her response, which she said we could use, was it would be unethical. Can you imagine that? Like, it would be unethical because we already know how bad that is for people. So you couldn't even do the experiment. Yet that's what we're doing. We've seen a 14-month experiment where it's, it's not just social media, but social media is certainly part of it. And so we are headed, and the issue for us, as far as we're concerned, is that there's a tremendous amount of infrastructure now in place. And now that things are heading more, kind of in a more normal direction, we're wondering what school is going to look like, not just next year, but 5-10 years down the road with all this investment that's been made. I think we're really going to face an uphill battle in terms of trying to pull back from this, even though we know that what we're doing is, it's a hop, skip, and a jump from there to say it's unethical what we're doing to kids.
Yeah, I would just conclude that post-pandemic, we got to do better for our kids. We've seen, like, the emperor wears no clothes. We've seen how bad it is for them. We've seen the toll it's taken on their mental health and mental well-being. Going forward, this can't be the future. We got to go back to more human interactions. There's got to be a renaissance of human interaction. And that's what we need. We need to do better for our kids. So thank you.
Thanks a lot.
Thank you. Thank you. And we really appreciate the challenge that you both have every day in your classroom or your virtual classrooms, knowing quite well the negative impact of the digital education on your students. But congratulations, you both managed to graduate students every year. Thank you so much for all what you do.
Thank you.
Thanks.
I would like to remind the audience that we will be starting the Q&A session with Dr. Russell. So please either use the raise hand button or put your question in the Q&A box, and we'll go through all of them. And now I will turn it on to you, Dr. Russell.
All right, thank you so much, CM, and all our excellent presenters. They were just fabulous. And I think the group together is just, it's amazing. So you all did a great job. And there are a lot of questions that we have. We don't have a lot of time, but we're going to go ahead and extend this about 15 minutes to get as many questions in as we can. And the first question is going to go to Joe and Matt. What are the alternatives that you recommend to a screen-based education?
So this is one of the kind of the real frustrating things was, when the world blew up 14 months ago, it was like nobody really even had a thought other than, well, what else are we going to do? Well, I mean, what would we have done? I mean, if this had happened 20 years ago, we would have just punted and said, well, I guess there's no school. we would have figured it out, right? So the first, I think probably the most obvious thing is we would have done some sort of, and there obviously, first of all, would be no perfect solution. But you can imagine a world where you could have pick up and drop off times. You pick up your textbooks, you pick up your work, you do the work during the week, you drop it off, and combine that. Since we have this, you can leverage the good side of technology and say, we'll have office hours, and if you've got questions, you can ask, or you can whatever via email or via Zoom session or whatever. So you can imagine some sort of combination like that that didn't require kids to be staring at a screen for 7.5 hours a day. That's the first thing. The second thing, you could continue to have school, just do it outdoors. Mask up, sit outside. It was Denmark, Sweden, Norway, someplace cold. They did the whole year out at Finland. What was it?
So,
It was
yeah.
It was cold, and they did the whole country was outside for school. I mean, it was because people here would say, well, I mean, it'd be kind of cold. I guarantee it was colder in Finland or wherever they did it. And so I don't know, you could certainly work on, I mean, if you took the money that was spent on computers and whatever else and spent it on tents and, told kids they had to bring a lawn chair or whatever. I mean, again, it's not perfect, but you could certainly do it and probably do it in a very safe way.
Yeah, I would just add, there seems the school, and this we may not do a great job of conveying this, or maybe we go over. The school systems in this country are so enamored with educational technology that they look for any excuse to add it, and that's been the case for decades. And of course, this was that excuse to go. It was at a trickle, and now it's at like a port. And to us, as soon as it happens, we know they're going to come out with op-ed saying what a success it was, even though we'll know it was a total disaster. And sure enough, that's happened. So, parents have to push back going forward once this is over, about online textbooks and about online homework, and push back and say, you know what, nah, I want my kid to have a paper textbook, because the studies out there that you learn more, you grasp more from a tactile textbook than you do from a digital one. It's just, you can't learn as much when it's not something that's physically present.
Great, thank you. Our next question, Dr. Eldawani.
The next question is for Dr. Dunkley. What would you recommend for physicians when they are in the exam room, entering and finding the teen hooked to their iPhone? How can you bring tactfully the subject in the exam room in the short time we have?
Is the parent in the room also?
Parent possibly in the room, also hooked on their iPhone.
Yeah. I usually start, well, sometimes I will ask the teen, could you put your phone down, please? I actually, if I know them well, I will actually take it, I will say, please hand it to me or put it on my desk because you can't stop looking at it. Definitely bring it up with the parent. You don't want to make parents feel defensive, because as soon as they feel, as soon as they're on the defense, you lose them. So you just want to ask if they have any concerns, ask how much screen time daily is going on, ask about screens in the bedroom, try to say, is there any way you could cut down? Can you try screen-free times, days, things like that. You can ask if the parents notice anything like lack of focus, sleep issues, attitude problems, like just being irritable, things like that. So if you can kind of approach it from the side and then point out, well, those things we know are related to screen time, that can be a way to open the conversation. So you want to align with the parents' goals, but you also want to find out kind of what they know and don't know, and start with the education piece as well.
Thank you.
All right, and we're going to have another question here for Matt and Joe now. Question from the participants. Kids are no longer being taught cursive handwriting since they will all be typing on keyboards for life. Do you feel there's something being lost in brain development by not learning how to write?
Yeah, I mean, there's, and again, I can't off the top of my head cite the studies, but there's all kinds of studies out there about just, and this is true of math and numeracy and any kind of understanding. There's so much more that they get from the tactile experience, right? Like my kid's trying to do, and I know this may be skirting the question a little bit, but my kid's trying to learn addition and subtraction by what Dreambox, where they have he's turning a digital abacus and he has no idea what the hell he's doing. And he just wiggles it until he gets the right answer so he can go play the game with the bunny or something. Like that's not as good as the little blocks and you count and you move. Like a kid his age needs to be touching 3. You can't just see a symbolic representation of 3. And I feel like that's true of reading and writing also. Like getting your hands in writing, I think brings you closer to, and it activates different parts of the brain that make you more aware of the message that's coming out than when you type. So, you know, I can't cite the studies off the top of my head. I know they're out there. I know there are a ton of them, and they've done the research where it's the smart people in the panel probably could cite the different parts of the brain that are activated when you're writing than versus typing. But yeah, definitely losing a lot.
Right. And I think, you know, and I've read studies also that show, they did a study looking at learning a language, whether you typed it or you actually spoke it. They're in writing it when you write a language versus learning it online. And once they give a test, if you learn it and then they give a test and right away, everybody gets 100%. But if you look at it, you know, 6 or 8 weeks later, the people who just learned it online, they fail. And yet the people who learned it with cursive handwriting, or handwriting. So there is definitely all those connections, and you're absolutely right. There is a lot of science that shows the motor cortex is really is connected to learning. And I think that's also why, you know, playing music and exercise are also associated with higher learning. So you're absolutely right. Dr. Eldawani?
Yes, I have a question for Dr. Kardars. It's from the audience, actually. As physicians, we have to spend tremendous amount of time charting on EMRs, electronic medical records. Can this have a negative effect on the adult brain?
Yeah, and by the way, I just want to really right on to Matt and Joe. By the way, my wife was a teacher for 20 years, and you guys really hit a sweet spot for me when you guys did your presentation, because I can't echo that enough. So I'm sorry to go off topic for that, but it was, and by the way, it was multimodal learning is the more senses we use, the more we retain. Yeah, EMRs, so they're going to be problematic. Screen time is problematic for us across all age spectrums, but more problematic for younger, more developmentally vulnerable. But if we're staring at a screen as adults, we get impacted both. Circadian sleep cycles get disrupted. You know, Victoria speaks quite a bit about that, what that does to our adrenal system. It's not healthy to be staring at a screen at any age, you know, but age and appropriate technology is more problematic than us old timers who are of a certain age where we have more fully developed brains, theoretically. But it's not ideal. It's not ideal to be doing that for extended periods of time. There was a mother in Maryland who used OSHA guidelines, and OSHA was office, you know, office safety guidelines. And she was looking to reduce school time in the classroom and was using 1990s OSHA guidelines, which limited how much screen time office workers can be in front of a screen because of the impairments to vision, because of the ocular impacts of screen time. And so she was trying to use these antiquated 1990s office guidelines that didn't allow office workers to be on screens for too long because of the visual impacts to save our children from similar effects. So yeah, not ideal to be in front of an EMR multiple hours a day.
Thank you. Cindy?
Yeah, and I think we have a question for Dr. Dunkley. I think you can restate this. There was a question earlier, which you might have addressed, but good to sort of condense it. During reset, do kids get withdrawal symptoms?
Okay, so it's kind of a relative withdrawal. So it's a lot of the withdrawal is psychological because they just feel really out of sorts and they don't know what to do with themselves. So part of the reset is really planning activities, time with parents, one-on-one, as well as with the whole family. And you really structure, especially the first week. So the first few days you see kids being kind of out of sorts, more moody, but really the younger kids adapt within a couple of days. And even with teens, you see them adapt within the first week, maybe 2 weeks. You really only see hardcore withdrawal if they're very, very addicted, like 12 hours a day. Then it can take a few weeks, sometimes up to 6 weeks, that you see them really being moody and listless and have no energy. And then they kind of snap out of it, which is really kind of what happens when somebody comes off of like methamphetamine. So, so yes, there is some withdrawal, but it's not as bad. Parents always think it's going to be awful, and it always goes more smoothly than they expected.
Okay, good. And here's a question for Matt and Joe. Is there a concern that screens will replace teachers?
I'm concerned.
I'm concerned. Yeah, I'm not tinfoil hat wearing conspiracy theorist that, there's some big movement to get rid of teachers, but teachers are definitely more expensive than, you can have a gymnasium full of desks and computers and have 2 or 3 monitors. And this is what Matt referenced, rocket ship schools and summit academies that are really being, I'm going to intentionally use the verb inflicted on lower socioeconomic communities that don't fight back as hard as would be done in a more affluent community. And it looks like, some sort of dystopian nightmare, the giant gymnasium. I mean, it's really going on like right now, without 250 kids, 3 monitors who aren't teachers, just monitors who just walk around, and their job is to ensure that the kids are staying on the screen, like not get up, walk away. There's one, what was the one, Matt, when we read, they were telling parents to send the parents of younger kids to send their a change of clothes because the kids were going to wet themselves because they were only allowed bathroom breaks every so often.
Yeah, that was ALS in Florida, the automated learning.
Yeah. So, sorry.
I wanted to add,
go ahead.
No, Joe, I was going to say, 5 years ago, pre-COVID, before you guys wrote the book, I wrote a Time op-ed where screens in the classroom, a $60 billion hoax. And this was when, because you're absolutely right. I mean, I wrote about this dystopian warehouse of students with 1 or 2 teachers or the guides on the side. And this was, unfortunately, a financially driven movement, right? It was because the irony of it, there's no pedagogical research that shows the efficacy of screens in the classroom or remote learning. There's not one study that shows the benefit of it. And it's a Trojan horse that allows all these potential clinical disorders to really kind of erupt in our kids' lives. I could speak for a second. I have 14-year-old twin boys, and man, it was devastating for them this year, their educational experience. And it was, and my wife's a teacher, and I know about screen time, and we still couldn't immunize them from the effects of this disaster that happened this year with Zoom schooling.
Right. Well, and so just to kind of put a button on or pin into that, I mean, for me and where Matt and I teach, no, I'm not concerned that screens are going to replace teachers. What I'm concerned about is in these much more vulnerable communities. Yeah, because it's already being done, and it's cheaper, and you can warehouse kids and pretend like they're not there, and that's that you talk about the wrong approach. I mean, it's the worst imaginable thing to do to the most vulnerable kids. That's the worry for me in terms of screens replacing teachers.
Great, and here's a related question from the participant. I know several young and very good teachers leaving the profession after this long year of loss of time and lack of student contact. What can we do in our communities to help right the ship? I'm thinking like a volunteer service corps to help with tutoring. My son's girlfriend in LA Unified, she just went back to the classroom and the teachers are in homerooms while the students change classes online. So teachers are babysitting.
Right.
So.
Well, in terms of what people can do, Matt mentioned earlier pushing back, because You know, the one thing that I know school boards fear more than anything else is parents. and, and parents are the ones that have the, you know, especially when parents mobilize in our school district. And I don't pretend to know the research behind what how much sleep a high school kid needs or whatever, but we totally reconfigured start times for schools because there were, and we're a big school system. We've got 180,000 kids. And I think it was like 20 parents just were really, really vocal about this issue. And the whole school system changed because of the voices of these 20. So it's not like you've got to get 10,000 people on your side. If you get educated and you talk to other people who are like-minded, and you can push back even a little bit, and you can start with small things. Like there was a school district in Texas we talked to where the only thing they were asking for was in an elementary school, one classroom that was going to be that wasn't going to have to do anything on computers or do a screen minimal classroom per grade level. Just one. You can, if you want your kid to have a screen experience in school, you can go to all the other classes in that grade level, but just have one for parents who don't want their kids to be on screens or whatever. And so when you start small like that, there are ways that you can kind of, I don't know, get people to see what's going on.
Yeah, and I just want to add to that. I think just working individually with schools, with families and stuff, a lot of times their first answer is no when you ask for something, and then you keep asking and asking, and then finally they'll do it. And especially I think if you phrase it as or you frame it as an experiment, well, can we just try it this way? Can we just try not having homework online? Can we just try paper alternatives? You know, can we just try it for a few weeks and see how it goes? And then, you know, you just have to work them down. But I do agree that when a group of parents bands together, that is powerful. They do listen. It just takes a while, but people have to speak up for sure.
Great. And you know, I do note that the New York Times has articles that show that an article that shows that Gates and Jobs and the Google execs, they didn't send their kids to schools that had computers. They actually deliberately did it because they knew it wasn't good for them.
Right.
So here's another question. How do we get all three of these presentations to California legislators who have 16 wireless broadband access bills speeding through the legislature with no opposition? This information is so important. We will have the videos available up on the website soon. So we're getting close to time. There was one other question. So, you know, this is Joe and Matt, in your book, you mentioned Dwight Eisenhower's famous statement in his farewell address to be cautious of the influence of the military industrial complex. Then you mentioned a warning about what others have termed the educational industrial complex. So in 2020, EdTech spending was about $36 billion. Some estimated it much higher. I wonder what the cost benefit to the schools is. They say that they're saving money, but actually are they? And although this may be good for the economy, is it good for children? So.
Yeah. Well,
you know the answer.
It's of course not good for children, and it's of course not saving money. A lot of the stuff they've spent this money on is like we've been talking about, unproven, and it's actually worse. It's been proven to be ineffective, and the research that they wheel out to support it is normally paid for by the people who are producing it. Hewlett Packard's a big one, Pearson's a big one, McGraw-Hill's a big one. Like the people selling it are the only ones who are finding it's working. So it's a colossal waste of money. And I guess I'm being optimistic when I say, and it kind of answers the previous question too, things in education always go back and forth. It's always a paradigm shift, right? And right now things are at an extreme. And I guess I'm optimistic and I'm thinking we've gone so far that people now realize how far we've gone. I think I'm hopeful for a renaissance in human interaction, and people are going to crave I think of like going to an ed tech convention next year. Like, who's going to be there? Who's thinking, yeah, let's do this more next year?
Yeah.
I don't know. I hope it's the end of this experiment. I guess that's what
All right. Well, great. I really appreciate it. We're getting close to the end of the time. I have a couple more questions if people are willing to spend the time. Question for Dr. Dunkley and Dr. Kardaras. At what age do you recommend kids have their own cell phone? That's a common one, and pediatricians get this a lot.
Okay, well, as you could probably guess from my talk, I really, I'm very conservative when it comes to screens and devices in general, and cell phones, smartphones in particular. To me, a child needs to be able to be functioning well, be performing where they should be academically, be socially, have a good social network, be in good condition, we have all these other activities going on. And then, so I would say, like, my recommendation really is, like, at 15 or 16, you give them a dumb phone or a flip phone or a gab phone, or, that kind of a thing, and see how they can handle it. They also should be, we have a whole list of, like, life skills, they should be doing chores and contributing to the family and things like that. So if they can show those kinds of things, that's where you start. But really, if you think about, the frontal lobe really isn't fully developed till the mid-20s. And smartphones weren't ever, when they made them, they weren't supposed to be for kids. So that's the brain-based answer, is that they're really not ready till their mid-20s. So.
All right. So wait as long as you can.
Wait as long as you can. Delay.
Yeah, and this idea that there's a set recommended age, I think Victoria is exactly right, that every child is different. So it's development, the supports, how they can handle different technology. So my 14-year-old twin boys got their first Gab phone last week, and the Gab phone it looks like a smartphone, but it's essentially a dumb phone because there's no Wi-Fi capability, so you can't game on it. You can basically text and make phone calls, and there's a movement that wait until waiting till eighth grade before you give a phone. I think, when you see 3-year-olds with a phone, it's ridiculous. It's again, I love the analogy that Joe, you said about the power tools and the 5-year-olds. We don't give kids car keys when they're not ready for them, and we shouldn't give them smartphones before they're ready for it, because we're just doing so much developmental damage. We don't even realize it. We're not going to see the full shockwave of what we've done for another decade or two.
There's also a movement of moms who are actually not giving their teens smartphones beyond, wait till 8. So there's a group, Screen Strong, where there's a couple thousand families on there now who actually are just using Gab phones even for their older teens. So that's a good place for parents to go if they want to try that, and they need, that's a good place for support to see how other people are doing it. I think that's going to happen more and more, just as more research comes out especially about the depression and the suicides and all that stuff. I think there's going to be more parents who are actually holding back. And I've heard also the parents in Silicon Valley, they give their kids smartphones much, much later.
Yeah.
As they're learning. So in California, Governor Newsom signed AB 272 to allow schools to adopt policies to ban or limit cell phone use in schools. I suppose we all agree with that. And should it be a stronger policy and require a cell phone policy? I think we all know the answer to that's probably yes, but it does show that in many states, this is really happening. People are really getting wise to it and wanting to ban these
There's one particular study that was on point with that really showed what happens to the achievement gap when you remove phones from schools. The London School of Economics did a study about 5 years ago with 40,000 students, and simply removing phones from the classroom was the single most effective reduction of the achievement gap. What they found was that standardized test scores went up 6% for mainstream students, and special needs students and poor socioeconomic students, their test scores went up 14% in classrooms that had telephones removed from them. So that's a pretty big reduction of the achievement gap by just removing phones. And that study was peer reviewed and got a lot of press about 4 or 5 years ago when it first came out.
Great, thank you. I think any other comments? We're going to go ahead and end. And any more pressing comments? All right, I want to thank superb presenters. This was fabulous, phenomenal panel. It takes a lot of time and it takes effort and dedication for you all to put all this information together in these little compact presentations and to answer the questions, and we really appreciate it. I want to thank Samira for running the webinar. I want to thank all the participants for your time and attention and your important questions. We hope to see you at the next webinar, May 20th, on children's environmental health. And just note that the webinar is recorded and it's going to be uploaded to the website, and it's in the chat box. If you have any questions, you can email Samira at sccma.org, I want to thank you all again. This was just terrific. Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye. Take care.
Bye-bye, guys.
You too.